Indication: Vyzulta lantanoprostine Bunad ophthalmic solution 0.024% is indicated for the reduction of intraocular pressure in patients with open-angle glaucoma or ocular hypertension. Important safety information: increased pigment of the iris and periorbital tissue or eyelid can occur. Iris pigmentation is likely to be permanent. Please see additional important safety information at the end of this video. Did you know glaucoma patients often have low nitric oxide levels? And that might be why their pressures stay stubbornly high? Lantanoprostine Bunad 0.024% or Vyzulta is the only eye drop designed to address that missing nitric oxide. Let's talk about how it works and where I'm using it in practice. Hi, I'm Dr. Constance Okeke, and welcome to Vyzulta Deep Dive, What Makes It Different. In this episode, sponsored by Bausch and Lomb, we're going deep into Vyzulta, the first nitric oxide donating prostaglandin drop. I'll share how it works, my own real-world study results, where I'm seeing success in practice, and a quick patient case to bring it to life. If you're passionate about staying current on glaucoma medications, go ahead and hit the like and subscribe button so you don't miss what's coming up. Vyzulta was FDA approved in 2017 to lower intraocular pressure in patients with open-angle glaucoma or ocular hypertension. It's administered once daily at bedtime and is available in both 2.5 ml and 5 ml bottles. Here's where Vyzulta stands out. It has a dual mechanism of action. Like other prostaglandins, it increases uveoscleral outflow via its lantanoprost acid component. But uniquely, it also delivers nitric oxide, which relaxes the trabecular meshwork, increasing conventional outflow. Why is this important? Nitric oxide is endogenous, meaning it's naturally produced in the body and plays vital roles in various systems, including cardiovascular and neurological health. In the eye, nitric oxide's downstream effects include altering the trabecular meshwork cytoskeleton to promote aqueous outflow. In fact, research shows that patients with glaucoma have lower nitric oxide markers in the aqueous humor, contributing to poor outflow and higher intraocular pressure. Vyzulta helps restore that nitric oxide pathway and is currently the only branded drop to do so. Comment on your experience with this unique pathway. In Phase 3 clinical studies of patients with open-angle glaucoma or ocular hypertension, with an average baseline IOP of about 26.7 millimeters of mercury, once daily evening dose of Vyzulta lowered pressure by as much as 7 to 9 millimeters of mercury over 12 months. In my own co-investigator role, I led real-world studies examining Vyzulta both as initial therapy and as a switch medication. Patients with high baseline intraocular pressures saw reductions over 10 millimeters of mercury and had a 41% mean IOP reduction from baseline. And even patients with low baseline pressures showed a meaningful 22% mean IOP drop. This consistency held up across both clinical trials and real-world practice. In another real-world study I led, 3 in 5 patients with mild to moderate glaucoma who switched to Vyzulta showed an intraocular pressure reduction of 5 millimeters of mercury or more from baseline at each follow-up visit. If you've tried Vyzulta in your tougher cases, let us know in the comments how it performed. In my practice, I use Vyzulta in 3 key ways. As first-line therapy, where coverage allows, because data, including my own, shows great results across both high and low baseline intraocular pressures. As a switch agent for patients not fully controlled on lantanoprost or other prostaglandin analogs, and as a single drop switch is preferred instead of adding a second medication. Also, for ocular hypertensives or early glaucoma patients who need simplified regimens. It's a strong choice when I need more pressure reduction but want to avoid layering more medications. Other situations where I see Vyzulta shine: after selective laser trabeculoplasty, where the target is not quite achieved and a simple regimen is desired to maintain trabecular outflow; when the intraocular pressure is close to goal but still needs a few points lower. And, though it's a prostaglandin, it's really well tolerated. Less than 1% of patients discontinued in clinical trials due to ocular side effects, and only about 5.9% reported hyperemia. Let us know your experience below in the comments. Now, some caveats. Coverage remains the biggest hurdle.
Step therapy is often required, meaning patients have to fail a generic first. It's also not ideal for patients who had severe prostaglandin class side effects like unwanted iris pigmentation or those who have a history of uveitis or macular edema. If it's denied at the pharmacy, submit a denial and appeal using data on intraocular pressure reduction and tolerability. Let me share a case. A 62-year-old female with primary open-angle glaucoma had been on latanoprost, but her intraocular pressure remained at 19 mmHg, with a target under 16. She also reported frequent missed drops and trouble squeezing the bottle. I switched her to Vyzulta in the 5 ml bottle and reviewed administration techniques. At her 1-month follow-up, her intraocular pressure was down to 14 mmHg. She experienced mild stinging, which resolved, and had no hyperemia. She's been on it for months now, satisfied with her pressure control and ease of use. Here's a quick checklist if you're thinking about using Vyzulta. Evaluate coverage first. If step therapy is required, document trial failure or use of latanoprost. Have samples on hand. They can help with early tolerability testing and improve adherence by avoiding an extra pharmacy trip. Educate your patient about what to expect. Mention potential hyperemia. Follow up in 4 to 6 weeks to check for efficacy and any side effects. And of course, if you had success appealing coverage with clinical evidence, share your tips in the comments below. So that's your deep dive on Vyzulta, what makes it different, and how I use it. We've looked at the science, the real-world outcomes, and even a practical case that shows what's possible. If you'd like to see more case examples and dive deeper into real-world studies, check out the additional video linked right here. And if you'd like a handy guide to help you set target IOP pressures in simple steps to help monitor your glaucoma patients, you'll find access to a free download in the description box below. Thanks for watching, and I'll see you in the next video. Indication: Vyzulta lantanoprostene bunad ophthalmic solution 0.024% is indicated for the reduction of intraocular pressure, or IOP, in patients with open-angle glaucoma or ocular hypertension. Important safety information: increased pigmentation of the iris and periorbital tissue or eyelid can occur. Iris pigmentation is likely to be permanent. Gradual changes to eyelashes, including increased length, increased thickness, and number of eyelashes may occur. These changes are usually reversible upon treatment discontinuation. Use with caution in patients with history of intraocular inflammation or iritis or uveitis. Vyzulta should generally not be used in patients with active intraocular inflammation. Macular edema, including cystoid macular edema, has been reported during treatment with prostaglandin analogs. Use with caution in patients who are aphakic, in pseudophakic patients with a torn posterior capsule, or in patients with known risk factors for macular edema. There have been reports of bacterial keratitis associated with the use of multiple dose containers of topical ophthalmic products that were inadvertently contaminated by patients. Contact lenses should be removed prior to the administration of Vyzulta and may be reinserted 15 minutes after administration. Most common ocular adverse reactions with incidence of greater or equal to 2% are conjunctival hyperemia at 6%, eye irritation at 4%, eye pain 3%, and installation site pain at 2%. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please see full prescribing information at vyzultahcp.com.